your program says Shawana Gray, but Shawana Gray is now Shawana Moore.
Yep.
So Shawana was married 12 weeks ago. And we're also welcoming a new member of our Jefferson School of Nursing family, her husband, Mr. Moore. And I can say that I knew Shawana when she was a BSN student, when she was an MSN student, and when she was a DNP student. So Shawana, if you could please come and share some words of wisdom.
Good morning, ladies and gentlemen, but more importantly, good morning, BSN graduates. Today you have a bride at your moment. Thank you for the warm welcome and introduction, Ms. Swan. And congratulations to all this year BSN graduates and award recipients. It was not too long ago that I sat in your very same room. I'm a proud 2010 BSN alumni of Jefferson School of Nursing. JSN, as Dean Swan mentioned, also awarded me both my master's and doctoral graduate nursing degrees. For this, I am truly thankful and honored to be an alumni speaker today. I would like to share my journey to obtain my nursing education at Thomas Jefferson University. It is my hope that you will be encouraged and empowered to think outside of the traditional role of nursing. But more importantly, it is my hope that you will believe in yourself and your ability to achieve in the profession of nursing. I graduated with a degree in biology from a small historically black university in 2008. During my junior year at this university, my mother suddenly and unexpectedly lost the ability to walk. She was transported from our home to Thomas Jefferson University Hospital for immediate care. Throughout her stay at this hospital, I witnessed firsthand the quality care nurses provided to patients daily. It was at that point that I decided to become a nurse. Before graduating in 2008, I began to complete web searches in search of nursing programs for second-degree students. Throughout my web searches, I discovered Thomas Jefferson University had an accelerated program for second-degree non-nurses to complete their Bachelor of Science in a 12-month period of time. Thinking back on the experience my mother had at Thomas Jefferson University Hospital, I knew immediately that Thomas Jefferson University was just for me. I applied and was accepted to the program in 2009. I completed the program that following summer in 2010 and decided to continue my nursing education because Jefferson School of Nursing had just started a master's program for women's health nurse practitioner students. Women's health has always been a strong passion of mine. Growing up in a medically underserved community of Camden, New Jersey, I witnessed firsthand how the lack of access and knowledge of quality care can impact the community. It was my hopes to complete my master's at Jefferson and serve as a women's health nurse practitioner in underserved, high-risk, and vulnerable populations. While in the master's program, I completed a capstone project on maternity obesity, which sparked my research interest. I began to research doctoral degrees in nursing that involve evidence-based practice with some aspects of research. That's when I discovered the Doctor of Nursing Practice degree, or the DNP degree, and thought it would be perfect for me, especially since the American Association of Colleges of Nursing endorsed the position statement on the practice doctorate in nursing, which calls for moving the level of preparedness of advanced practice nurses from master's degrees to doctorate level degrees by 2015. I met with Jefferson School of Nursing faculty to discuss my interest in pursuing a doctoral degree in nursing practices. My interest was met by faculty with enthusiasm and encouragement. I applied for the DNP program just prior to completing my master's and was accepted. I completed my master's degree in 2011 and began practicing as a women's health nurse practitioner for an internationally known nonprofit healthcare organization where I'm able to screen, educate, and treat women for health issues impacting their lives daily. While practicing as a full-time clinician, I completed the DNP degree at Thomas Jefferson University in a two-year period of time. This program opens up my mind to evidence-based practice, research, leadership, and health policy. As a women's health nurse practitioner, I focus on a practicing priority project related to women's health. My practicing priority project examined the 2009 Institute of Medicine recommendation pregnant women and the impact weight gain had on maternal fetal outcomes, specifically gestational diabetes and large for gestational age infants. This project was accepted for presentation at the 2014 Association of Women's Health Obstetrics and Neonatal Nursing Convention. So in my pursuit to obtain my education at Thomas Jefferson University, I became an educator, I became a researcher, I became a healthcare provider, but most importantly, I became a nurse. I encourage you all to pursue graduate degrees as clinical nurse specialists, as nurse practitioners, as midwives, as nurse executives, and as nurse care coordinators. I encourage you all to seek terminal degrees by obtaining your PhD, your DNP, or EDD degree. Your opportunities are limitless. Remember, you set your own limit on your educational and professional endeavors. Jefferson School of Nursing has prepared you for this task at hand. You are among the brightest in our nation. JSN has prepared you to be a change agent in whatever nursing role you assume. It has not only contributed to your intellectual development as a nurse, but more importantly, it has contributed to your character and your integrity as a nurse. Remember, never view yourself as simply a nurse. Nurses are innovators. We are educators. We are researchers. We are policymakers. We are administrators. And we are pioneers leading changes to healthcare, both nationally and internationally. I leave you with one word to always keep in mind, and that's to believe. All things are possible if you simply believe and have the faith to receive it. So I challenge you to believe, to continue to seek higher education, and don't be afraid to ask for help along the way. You will find lifelong mentors by simply seeking assistance on your journey. I congratulate all this year BSN graduates and award recipients, and I thank you for listening to my journey to obtain my education in nursing at Thomas Jefferson University. It is my hopes that you will continue your nursing education. I truly look forward to hearing your nursing educational journey someday. Special thanks to Jefferson School of Nursing, Dean Bethan Swan, Dr. Ann Phelan, Dr. Zane Zikowski, and the Student and Alumni Affairs Committee, and special thanks to my husband for traveling for moral support here today. Congratulations again. Enjoy this moment. There's so much more waiting ahead for you. Thank you.